Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today, I'd like for you to stay glued and transfixed to your television because we have an exciting show tonight, and the show is titled Plantar Fasciitis. What that really is it's a chronic heel pain, or acute or chronic heel pain that people get that's quite common. And it's come to our attention within the practice that we're seeing an increasing amount of people suffering from this condition. So as a result, I've brought in two notable and knowledgeable health practitioners. One is Dr. Ken Kirsten. He is a chiropractic physician and is a specialist in sports medicine. And I've also brought with us Kathleen Hadjunemeth, licensed physical therapist in New Jersey. Both of them have quite a amassed experience treating and diagnosing plantar fasciitis. And what we're going to do here tonight is educate you on what it is, what treatment is available, and different treatments that you may receive to get the necessary results that you're looking for. Initially, we're going to do a chiropractic orthopedic workup on plantar fasciitis along with its treatment. Secondarily, Caitlin Hadjunemeth is going to go and do a physical therapy approach towards the treatment of the condition. And then we're going to follow up using the acupuncture approach treatment of the condition. And we're also going to give you a tremendous amount of home therapies that you can do and things that you may potentially do to help cure, treat, and prevent it, possibly without any need of a healthcare professional. As our model today, we're also very lucky because we have Erin Riley, who's with us today. Erin Riley is a professional Irish folk dancer with river dance. And she's going to be our model today. And at the end of the program, she's going to do a dance for us. So please stay tuned. Dr. Kirsten and Erin, thank you for being with us today. Let's get right down to it. Dr. Kirsten, tell us about plantar fasciitis.
Okay. Well, plantar fasciitis is a condition to the plantar fascia. The plantar fascia is a hard or a soft fibrous tissue, a tendon-like tissue, that runs from the bottom of the foot at the ball of the foot, courses through the midfoot, and attaches to the heel right in here. And what happens in plantar fasciitis is you have an irritation of that tissue, or a swelling or a contracture of the tissue, and it causes extreme pain in the foot and the heel.
What's the cause of this?
Well, there's many causes of plantar fasciitis. Most of it is overuse. Athletes, running on hard surfaces. Also, too, just structure of the foot. A person that has what we call a pes cavus, or an enlarged arch, or a very high arch, has a tendency to have more irritation to that plantar fascia. People that also have flat feet, or pes planus, or a fallen arch, can exhibit weakness in that, and it can lead to irritation and swelling of that tissue also. But most of the time, it's overuse, muscular imbalance, contracture of the Achilles tendon. Women that wear a lot of high heels all the time tend to have this condition also.
What's the reason why people will frequently say when they first step out of bed in the morning and put their foot down, weight down on their heel, that that their pain is severe during that time when they haven't been using it then?
That's one of the keys in diagnosis through history. We'll find out that the patient will describe extreme pain upon morning when they take their first few steps, and that's because after being off your feet for some short time, a few hours, the tissue itself begins to contract or become adhesed and allows that inflammation to persist. And then as you step, you stretch that tissue very rapidly with no shoes on or no support and stepping on a hard floor. And it's often like they present like they're stepping on glass, or you're feeling, that's what they say, I'm stepping on glass, it feels like. And that's an indication that's plantar fasciitis.
Mm-hmm. What's the correlation between the heel spur and plantar fasciitis? It seems like that's something that goes together frequently.
It does, but the fact is that it's people say, I have pain because I have a heel spur. Actually, it's the heel spur that's not causing the pain. It's the plantar fascia itself, the irritation. And it's often misdiagnosed in the fact that the plantar fascia, the continual irritation to a soft tissue, will result in calcification of a tissue. And that calcification begins on the insertion into the bone. So by the chronic pulling or the irritation, calcium deposits begin to form, and they fill in, and they begin to form a spur, which is actually protruding forward like this. So in rare cases, the actual heel spur will be painful, in the fact that if the heel spur is more located downward, or you have severe arthritis or trauma. But most of the time, the heel spur is not the cause of the pain. It's the plantar fascia itself, the irritation. So nothing really needs to be done with the heel spur itself.
What modes of treatment do you incorporate to?
Well, first you want to use, in the chiropractic portion, is mobility of the foot. The foot itself, after examination and looking at and diagnosing the condition, the foot is actually supposed to be like a loose bag of bones. People think that just having a flat foot is bad, but actually a lot of times a high foot or a high arch or a pes cavus, what we'll call, will cause pain, and that sometimes is more difficult and more present and more oftenly associated with plantar fasciitis because of the high arch, showing that the tissue is contracted. So what we need to do is loosen the foot by manipulating the whole foot through the heel, through the midfoot, the forefoot, and the toes itself, and stretching the calf out, the hamstrings, the peronei muscles, the muscles on the side of the leg here, and just having the foot be flexible and having it properly supported.
Are there any bony fixations that seem to be more attributable to plantar myofasciitis than others?
The key is what we call the first ray. The first ray is made up of the metatarsals of the foot and the phalanges, which is right in here. That's very, very important. We need about 60 degrees of flexion or dorsiflexion of the toe in order to cause the mechanism or the function of that plantar fascia. And what that does is, by doing this, if you let your foot relax, if I do this, you can actually see the foot rise up, and that's called the windlass mechanism, where it actually is involved in propulsion or movement of your foot. If you didn't have the plantar fascia, you would have no toe off, or you wouldn't be able to accelerate. That's particularly important in runners. Runners need this. They need flexibility here. So the key we want to manipulate here is flexibility of this first digit right here, this first ray. And also, too, they associate that with, when you hear athletes in games, turf toe. That's what turf toe is. It's a restriction or inflammation of that joint. And that's why it's actually very, very painful. People think that these guys are, their toe hurts. But you take this toe away, you totally lose all propulsion and speed, and you lose total agility at times. And it really decreases flexibility and speed.
So a gait analysis or walking analysis is a key component of this?
Absolutely.
What about something like orthotics? Do you use that as part of the treatment?
Yes. Orthotics is something that we don't want to use a rigid orthotic in plantar fasciitis, because you don't want to make that surface harder. Okay, we want to allow that to soften. But there's specific orthotics for specific foot conditions. Like I said, there's pes cavus, too high arch, we want to support it on the outside. There's flat feet where the foot will roll, become irritated, and sometimes people need what we call a posting here underneath the toe, especially marathon runners, where they need that flexibility. Also, just incidentally noted on Erin here that she has a condition which is just visually diagnosed called a Morton's toe, where the second digit is longer than the first digit. Okay, and what that does is that shifts the translation of all her force into this toe. Now this is taking up more of the force as this toe, and anatomically it's not capable of doing that, taking load. So people that have a Morton's toe chronically have what we call metatarsalgia, which is another condition associated with plantar fasciitis, and it puts all the strain on this part, and because all the propulsion is taken up in here, and it puts a lot of strain here, and it causes a lot of pain. And I think, Erin, that you actually had this condition. You had to actually get cortisone shots for that because of the Morton's toe with dancing.
Is that the piggy that stayed home?
That is. No, I don't know. With the tattoo.
What about short leg syndrome or lower back pain? Pelvic instability. Is that
well, that all leads to it because, like I said, the foot is supposed to be a loose bag of bones. That's our shock absorption when we walk. That's our input. So this is part of what we call the kinematic chain. Okay. Anytime you affect the ankle, foot, long term, it's going to eventually cause knee pain or chronic knee problems, lead up to the hip, and cause back problems. So anytime somebody comes in even with low back, I'm always assessing the hip, knee, foot, and making sure that there's not an external cause of that back pain. And by having a chronic plantar fasciitis, metatarsalgia, any condition in the foot, it can absolutely lead to leg imbalance, pelvic
suppleness and level foundation.
Absolutely. Yeah, these are your
key
wheels.
Components.
Yeah, the body is a closed system. Nothing exists in isolation. So you're always going to have adjacent compensatory effects in other areas.
Now, what about expected rate of recovery? Does that depend then on the nature of whether a person's athletic by nature or what modification of activity? It's
always hard to get a runner to stop running, but that's what we need to do. We need to first give this rest. I mean, the rest is key with this, and it takes about a total of 6 to 12 weeks for rehabilitation on this, the number of modalities which we're going to go on later. But the fact is that you need to just change your habits. So in the meantime, when it's very acute, instead of running on a hard surface or gravel, you want to maybe move to grass. Get yourself a support. Maybe get in swimming or biking. Take some of that pounding out of it while you're going through the therapy, because that will allow the healing to accelerate. But pretty much you want to get off it as much as you can and not irritate it.
Mm-hmm. Is this supported at all, separate from orthotics? Do you do things? Is there any kind of brace or anything that's needed?
Well, you can do taping. Yeah, you can do what we do with athletic taping and actually mimic a support. So we would tape across here, tape underneath here, tape across here, and actually mimic a plantar fascia. Mm-hmm. And the taping is very good in helping, like say if someone has to run a marathon or something and they're totally not healed, we would tape the bottom of the foot for support and use an orthotic also.
Yeah, I see the whole science of taping has gotten into a whole
taping's really good.
Big thing now as far as that's concerned. Any other words of wit when we go on to our physical therapy component?
I'm totally witless today.
All right, Dr. Kirsten, thank you for coming aboard and sharing that knowledge with us.
Glad to be here.
Good. Cataline, thank you. Now, along with the normal assessment that would be accompany the both chiropractic and orthopedic approach, which I'm sure will have similarities, what would the physical therapy aspect of the adjacent musculature and soft tissue have to do with the condition?
Well, you would want to take a look at all the muscles in the lower leg, including, and most especially, the muscles in the posterior aspect, which is the gastroc and the soleus complex, as well as the anterior muscles here, as well as the peronei, which actually are the ones that help support the arch over here. What we've commonly found is that a lot of patients that complain of the plantar fasciitis actually have a lot of tightness through the muscles back there, which actually makes the Achilles tendon quite tight. Once that's tight, it actually can pull on the calcaneus, which can provide more pressure really onto the calcaneus as well down here, and put more pressure onto the plantar fascia.
So a leg problem causing the foot or heel problem?
Yes, could also be a common cause.
Okay. And will the patient be tender in and around?
Yes, they'll most likely be tender in and around through here. They'll also maybe tender in through some trigger points through the calf, through the gastroc, and through the soleus down here, and of course right underneath the heel.
If a person was loose, let's say it was an athlete that did do a good amount of stretching, and they had loosened, they were loose in here and they were loose in at the Achilles tendon, would that mean that the condition would be regionalized into the heel? Would it be localized there, or maybe not, or?
No, even with athletes, even though that they do a lot of stretching and things like that, just because of the repetitive use and actually the strong muscle tone that they have in there, you can still find some increased tension in through the muscle that can again just create more tension down through there, affecting the heel.
Okay, so looser, loosest is a good program with this.
Yes, most of the time these muscles are not the ones that loose, but they're more the supporting muscles of the ankle that actually are the proprioceptive type of muscles that help with your balance, and usually after recurring injuries to the ankle, be it an ankle fracture, the rehabilitation isn't complete, and that's why you tend to have instability left at the ankle, which can again cause plantar fasciitis.
Show us some keys to rehab.
Well, initially a physical therapist would usually use some modalities to help enhance the healing process as well as reduce some of the pain. One of the more common ones would be ultrasound with a head like this. Basically, it uses an electric current to vibrate a crystal that's in the sound head. It can be used to create deep heat in through the plantar fascia to make it more extensible during stretches, It can also enhance the healing process to really to make the inflammation go quicker and reduce some of the pain that comes along with it.
Okay. So will you do that sometimes prior to, as preparatory to your treatment?
Yes, usually in the initial part of the treatment, we would start with that, especially before stretches. It would heat up that area, and then the stretches would be a lot more comfortable and a lot more useful. The other thing that we would do is, instead of using just plain ice, we would use ice massage. We would make an ice pop and take the ice and directly rub it on the plantar fascia until it's numb. And then
I've never seen that like that. I've never seen that technique. I'd like to see that in action one day. And how about what would be some of the effective stretches for home use, or what you would do?
One of the most effective stretches really would be to actually stretch using the big toe, since that's the mechanism that actually increases the arch there. So just doing gentle, repetitive stretches, and that helps realign the fibers of the plantar fascia.
Can you feel that?
Mm-hmm.
Does that feel good?
Yeah.
Well, I would imagine, Darren, with the dancing, it actually, you know, a lot of the work that you've done on your toes like that, it would have a jamming effect like that.
Another stretch that we would again use would be for the gastroc muscles, and by keeping the knee straight and bending up at the heel and the ankle, we would provide a stretch through there as well as through the Achilles tendon. That would be one of the stretches. And as well, this stretch could also be done with the knee bent, and that would get the soleus muscle, which is lower down. And these stretches could also be taught in standing, so that the patient can do them at home on their own. And that's usually part of the rehab that they do on their own.
Mm-hmm. So there's active and passive stretches, the
Yes.
ones that you would do, or which are a little bit more aggressive in office than a
Yes.
person would do at home.
Mm-hmm.
What are some other things at home? Is soaks or something like that beneficial for this?
Soaks usually not very helpful, but again, we recommend that the patients actually do the ice massage technique at home a few times during the day, usually about 5 to 8 minutes, until it's actually quite numb on the bottom. Again, it helps with the pain and also helps take out some of the inflammation. We also suggest staying away from wearing high-heeled shoes and wearing more flexible shoes, such as a sneaker. Again, we can do some taping as well to help alleviate some of the pain. And it's very important that the patient actually do their exercise program on a regular basis, which would consist of a lot of the stretching exercises as well as strengthening exercises for the muscles that, again, support that area, as well as some proprioceptive or balance type of exercises as well, help retrain all the muscles in the lower leg, which would provide more stability in the foot.
Okay. How about, what was that you were mentioning on the way over here today about a golf ball? Do something about
wonderful
a golf ball technique?
Right. And
an additional use for a golf ball?
For those that can't golf, but do have the balls there, it's a great way to actually provide deep massage into this area and help break up some of the adhesions. And basically, you put your foot on the ball and really press it down really hard so that you get a lot of pressure in through the arch of the foot.
Mm-hmm. Now, I have found with some of my patients that have this, if it's really chronic, when you're actually palpating along that ligament into the heel, it'll almost feel calcific or crystalline buildup in there. Is that what is that?
You tend to get just very thickened nodules, which is just thickened areas of the tissue, and they're actually quite palpable throughout the entire plantar fascia when you do have chronic inflammation, and those are the good areas to get that golf ball into.
Mm-hmm. And they'll smooth out over a period of time?
Over time with stretching and continue to work.
What about these topical anesthetics and creams and all these things that people come in with nowadays? I mean, you know, I'm not going to start to mention one after another with that, but does that do much? I mean, is there anything that really...
They don't hurt or harm. They just help with really the alleviation of pain, but they really will not correct the problem.
Okay, so there's kind of a psychosomatic effect there. And thank you very much for your expertise and coming along. And up next, we're going to do acupuncture on Erin, and we'll show what that can do to help the condition. Acupuncture in traditional Chinese medicine, incorporating the use of electroacupuncture, laser acupuncture, and direct needle acupuncture, have proven to be very effective in the treatment of plantar fasciitis. The average patient that comes in with the condition, whether it's acute or chronic, averages a need for about anywhere in between 4 to 8 treatments, with the average being 6. Most people that come in with this condition start to see a change in their condition in and around the 3rd treatment. Treatment for the condition takes anywhere in between a half an hour to 40 minutes. And at the office, we incorporate a lot of what has been previously discussed about in the home as the home care component of it. The acupuncture doesn't take the place of the stretching, but we incorporate all of these other things in what we're doing, and then the acupuncture works independently of all of these other systems. This is how it works for the problem. Muscles have within them something called spindle cells. Spindle cells are little coiled shaped cells that control the tension, the normal tension within the muscles, such as the calf muscles, the gastrocnemius, and the soleus. Stretching frequently helps the problem in and of itself, but what we find out when the ligaments and all of the support tissue are stretched, but the muscles continue to go into either a spasmodic or hypertonic state, and their resting point, we need to reset the spindle cells, which are the control mechanisms within those muscles that make them relax to a more normal tonicity. All needles that we use are single-use disposable sterile needles. The treatment itself incorporates the use of anywhere from about 20 to 30 or 40 needles, depending on the severity of the condition and where the tender points are and the reactive condition. We're going to demonstrate that right now. Acupuncture doesn't hurt. Certain points that we needle are very, very tender to the needling process, depending on whether they're sore to begin with. But it's a very effective treatment. Aaron, who I've previously diagnosed with the problem, is tender right along this medial and lateral margin, and also we're going to do needling right around the Achilles tendon. Insertion of the needles, depending on the condition and the patient, goes in anywhere from about 1/4 inch to anywhere from 1 to 2 inches, depending on how deep the underlying problem is. We do something called applied kinesiology, or muscle testing, to rate the strength of the muscles. We can do that digitally, or we have equipment that will actually measure the muscle strength. Once the needles are in, the patient feels an elongating response or a tranquilizing response come over the course of the legs. They'll actually feel a tingling and feel things spread. If the condition is really bad, we'll do electroacupuncture, which is we have an instrument upon which we will put the electrical current actually through the needles. This has a tendency of being a little bit more effective than just applying electrostim to the superficial portion of the leg, which causes the current to pretty much go across the surface. This allows us to center ourselves right into the middle. Depending on how tender it is around the tendon, there can be anywhere from 2 to 8 needles around into this area. And this will also cause an elongating response. When a patient's in the office, frequently we can lift their leg up more, and we can needle the front portion of their foot, even though they're face down, and this allows us to get treatment in many different directions all at one time. For those of you out there that have this condition and are needle shy, laser acupuncture can be incorporated with that, which does not break the superficial portion of the skin, but can be done externally. The condition in Chinese medicine is known as a bony bee syndrome, and it affects the musculature of the involved region. As far as additional home care, I will have the patient take 3,000 milligrams of vitamin C complex we'll have them take bromelain, chondroitin sulfate, or magnesium sulfate, and they can also take MSM, which is a plant-derived natural anti-inflammatory that helps in joint rehabilitation. As long as there's women wearing a lot of high heels out there, I'm going to have a future in this business, keeping myself very active. Most of the time within acupuncture and Chinese Oriental medicine, a person will come in and they may have the plantar fasciitis on one foot alone, but frequently we will treat both simultaneously because the underlying problem is usually going on to some degree into the opposite leg, even though it's not symptomatic. For those of you out there that are seeking relief of this condition, we believe firmly that it can be found at our office. It can be managed reasonably at home and managed reasonably and financially without going into a big rigmarole. Thank you very much. I'm Dr. James R. Golding, and thanks for watching.